The last thing we want to demonstrate to you today is some of our physical rehabilitation. You know, along with doing the soft tissue, taping, other modalities like ultrasound or e-stim, another important component to treatment is active care, care that you can do at home, at work, at the gym, etc. So physical rehabilitation really funnels down into two major, subgroups: mobility and strength. Mobility is the stretching of muscles that you should be doing after any time you do a strenuous workout or any strenuous activity that you might even do around the house, like gardening or doing chores, things like that. So we've already done some work on the IT band, the quads. We're going to do some work now on the hamstrings, which are a very kind of highly neglected group of muscles when it comes to knee pain. So many times patients come in, they have knee pain. It's not until you treat the hamstrings that you really start alleviating the problem. So Terrence is going to lay on his back. But at home you can use, a sheet, a towel, even a resistance band that you might have. So he's going to keep his knees straight. It's around his toes. And he's going to pull up while he's lying on his back, up, and this is going to put a really good stretch on those hamstrings here. And not only just his hamstrings, but he might even feel this up into his calf, his gastrocnemius, along his Achilles tendon, even the plantar fascia of his foot. His body is going to tell him where he is tight, and depending on the height and how you have it positioned, you might feel a stretch more so in the hamstrings in one area. You lower it, you might feel it more in the calf, etc. So this is a great stretch. Also, because he's on his back, he's not leaning forward and rounding his lumbar spine, which places a lot of stress on that lower back. So this is a phenomenal stretch. You're hitting so many different structures, and I usually recommend holding it for at least a minute if you can, but if you can't, breaking it down from there. If it's really easy for a minute, start ramping it up. And that's it.